Do you know someone with Chiari malformation or have you heard of Chiari malformation? Chiari malformation is a neurological condition causing many symptoms and sometimes disabling long-lasting issues. Today I will tell you what Chiari malformation is, how it is diagnosed, and the symptoms that come along with the condition, the treatment options that are available, and awareness. So what is Chiari malformation? There are 4 types, but today I will be talking to you about Chiari 1 malformation. According to neurosurgeon Dr. Michael Flanagan, this is a condition where a portion of the brain called the cerebellar tonsils, they extend out of the opening of the base of the skull, which is the foramen magnum, and pushes into the spinal cord. This causes a disruption of flow of the cerebrospinal fluid, or CSF. So you can think of that as a rock in the middle of a stream and water trying to rush through there. To be given an accurate diagnosis, a patient must undergo imaging. An MRI study of the brain and the neck would be done. This would include the full spine as well sometimes if further treatment or surgery is needed later on. I'm sure you're curious about the symptoms that Chiari brings. There's what's called a Valsalva maneuver, which is coughing, sneezing, laughing, leaning down, anything that can cause pressure buildup in the head. That pressure buildup is from that CSF fluid on the brain, and that causes those symptoms. That main symptom being a headache. Those headaches radiate from the back of the head and the neck and go towards the front. Excuse me. They cause severe neck pain and those headaches. Because of the ongoing pressure on the spinal cord, other symptoms might also include muscle weakness and or stiffness, dizziness, balance issues, numbness and tingling throughout the body, including the face, nausea, vomiting, speech and swallowing problems, reduced ability to feel, temperature, double vision, and sleep apnea. Patients with Chiari malformation also may develop what's called a syrinx in their spinal cord. This is due to a constant obstruction of CSF flow. This is an elongated fluid cyst which expands over time and can cause more damage to the nerve fibers in the spinal cord. Symptoms from a syrinx may or may not ever go away, and they will require more treatment. There are conditions that are also associated with Chiari that are like sister conditions. So kind of like if you have diabetes, you might have kidney issues or heart conditions. So with Chiari, there's Ehlers-Danlos syndrome. That is a connective tissue disorder causing loose joints, or what you might also think of as double jointedness. Another is hydrocephalus, which is a buildup of fluid on the brain and the spinal cord, which is very common. Next is a POTS, which is post-orthostatic tachycardia syndrome. That causes passing out, and then there's many more. And then you might be wondering, with all these symptoms, how do you find treatment? Once you've been evaluated properly by your physician, an MRI confirms a diagnosis of Chiari malformation, you would be referred to a specialist. A neurologist is the first physician to see after a diagnosis. They can help facilitate the symptoms through medication. Neurologists can prescribe headache, pain, nausea medication, and others as needed. If pain is severe and the patient's quality of life is declining, the neurologist will refer you to a neurosurgeon who will determine if the symptoms are severe enough for surgery. Neurosurgeons will base the surgery off the patient's symptoms, and they'll also look and see how far the cerebellar tonsils herniate down below the foramen magnum. So the herniation here. And according to Dr. Robert Friedlander, MD at University of Pittsburgh Neurosurgery, the decompression surgery will be performed to create, excuse me, more space. So the neurosurgeon, they're going to cut the back of the neck here and create an opening. A small portion of the skull will be removed here in the back to make a bigger opening. And they'll widen up that foramen magnum here at the bottom. And some or all of C1, which is one of those vertebrae, will be removed. And then the tonsils here are lifted up. And those will be held in place with some artificial membrane. Multiple surgeries may be needed after or in the long run if symptoms come back or if a syrinx forms. Some patients will develop a lot of scar tissue, and that will need to be fixed as well. Continued follow-ups and medication might be needed to be sure that the surgery is successful, and regular MRIs are needed to monitor conditions. Excuse me. Lastly, I want to bring your attention to awareness of the condition. September is Chiari Awareness Month. It's represented by a purple ribbon. Each September here in Michigan, there is a walk in Shelby Township at the Stony Creek Metro Park. Chiari walks are offered all over the country. If you're not able to join a walk, you can do a walk anywhere on your own. As the cause is unknown currently, research is ongoing. Donations can be given online at conquerchiari.org. In conclusion, my goal has been to see that I have brought attention to this horrible, debilitating condition. I hope that even just one person's awareness can help someone get help from their physician. You know now what Chiari malformation is, how it is diagnosed, what symptoms to look for, what treatment options are available, and ways to help me bring awareness to others. Come join me and my family and friends next September as they walk with me to fight against Chiari malformation. Thank you.